Welcome to another episode of Your County. I'm your host, Dianne Parker, and we are here at Riverstone Health with John Felton, of course, the CEO and president, and it's so great to be here. Thank you so much for inviting us by. I know you have been very busy lately.
Yeah, thanks for the invitation. We're happy to talk about our organization.
Yeah, we are going to get into a little bit of information about COVID, coronavirus, just from a historical standpoint. What are some of the changes that we've seen here at Riverstone Health? What are some of the things that are working? Some of the things that will never go back to how they used to be? We're going to get into all of that. But first, we want to know, how is Riverstone Health structured? Because I know this is a partnership, and this show in particular looks at the county portion of it, but it's really just a huge partnership.
Yeah, Riverstone Health has been around since 1974, originally as the Yellowstone City County Health Department. But a big change happened in 98, and that was when a law changed in the 97 legislature, and a decision was made to take the health department and step it away from the county just a little bit. So we created a new entity, which we now call Riverstone Health, that is a public entity. So we are the government, and we're here to help you. But it's created through an agreement between Yellowstone County, the city of Billings, the city of Laurel, and the town of Broadview. But it creates an entity that's not part of any one of those. And so we have a governing body, the Board of Health. Our employees are employees of Riverstone Health, not of the county or the city. But it's been, in my mind, the single most impactful change on public health and health services that we provide was that transition, because it allows us to be much more nimble and much more agile as an organization.
Right. And I understand about 6% of the budget is probably funded by the county specifically. Does that sound about right?
Yeah, it's around 5-ish%. In 2002, the voters of Yellowstone County voted to approve a permanent mill levy for public health. That provides us about $3 million a year right now out of a $60 million budget. And what's really key about that in my mind is that it's a relatively small part of our budget, but most public health is funded through federal funds that go to the state and then get dispersed to local health departments. What that really means is the priorities for public health are largely determined in Washington, D.C. and Atlanta, Georgia, where the CDC is. And so where the money comes from kind of tells you what you need to do. Local funding lets us make our own local decisions. So we've invested in things like Healthy by Design, where we look at how do we make our community healthier overall? How do we make the healthy choice the easy choice? Several years ago, the legislature reduced funding for tobacco prevention. Most health departments in the state stopped doing it. We did not, because we used some of our mill levy money to allow us to make that priority for ourselves. So it really gives us an opportunity to focus on public health just in our community.
Okay, that's great to have a little bit of that local control on issues that are important to the constituents out there. So I know you have been here for several years. Tell us about your career history, where you started. I think 17 years, right?
Yeah, I've worked here for 17 years now. When the decision was made to create the new model, that happened in 1997. I was actually the CEO at the Northern Rockies Cancer Center at the time. And because of some experience I'd had when I was in Cincinnati, I was asked to be part of the community steering committee that created that district. So I did that in 97. I actually joined the Board of Health, which is our governing body, as an original member in 98. I was on the Board of Health from 98 to 2004. And then in 2004, I came to work here as the Chief Operating Officer, did that for 7 years, and became CEO on July 1 of 2011.
Okay. And there was something going on back then on that day, that week too, right?
Yeah, so 1st of July of 2011 was a Friday, and I had kind of planned this really nice, quiet transition into my new job. I'd already been here for 7 years. Everybody knew me. It was no big change. And that lasted for about 22 hours, because 22 hours into my career as a health officer is when the pipeline burst in the Yellowstone River. So my first weekend as the CEO and health officer was spent managing an oil spill in one of the most pristine rivers in North America.
Wow. And you have just been extremely busy ever since, the past few years, no exception, with everything that we have going on with coronavirus. What has it been like for Riverstone Health and for you going through this, just from a big historical standpoint, having a novel virus and a global pandemic?
Yeah, public health always prepares for a pandemic. We have a pandemic influenza plan. We've done drills on pandemic plans. And it's kind of like a sports team. You can practice all you want, But when the ball is in the air, it's a whole different game. And I think we've learned a lot of lessons, one of which is we need to practice our emergency preparedness, but that's not like actually playing the game. And I think there's going to be some good things come out of the pandemic. I often get asked that question, will anything good come out of this? And I think the answer is yes. We've proven that we can be very nimble. We didn't know anything about doing testing, but we set up testing. We'd done vaccines, but we had to do vaccines on a mass scale like we've never done. We've dealt with 2 surges now, and now we're into the 3rd. Fortunately, we have a long history of working with our local hospitals and local disaster and emergency services. And so when we went into Unified Health Command mode, we had done that. We knew everybody. We knew how to work together. But we've had to create things. We've had to redeploy staff. We've had to basically make up kind of out of whole cloth how to respond to the pandemic. So that's the good things that come out of it. I think the staff of Riverstone Health, as well as the staff of our partner organizations, have really proven that they will stand up and do what needs to be done. There was a time, particularly during the 2020 surge, where I bet there was maybe a quarter of our staff who were doing the job we hired them to do. Everyone was redeployed into doing testing or managing data or doing case investigations or contact tracing, whatever it was. And people just stood up and did the work. So it's an organization that's really easy to be proud of and it's easy to be proud to be a part of. And so I think there's some good that will come out of that. The downside is it has really worn people out. We talk a lot in healthcare about the importance of resilience and how do you maintain joy in work. That's hard to do when the work is really hard to begin with. But some of the slings and arrows that have been thrown in our direction have really worn people down.
What's something out there that the public could do to help with this? Because I know you have a lot of staff members who are working really hard.
I think when it comes to controlling the pandemic, a lot of it is personal decision. And we live in a state where personal responsibility is kind of a watchword. It's sort of what we live by, kind of the code of the West, if you will. But even if people choose not to get vaccinated, which we believe they should, they still need to take care of themselves and take care of others. I said many times during the pandemic, people shouldn't wear their masks or maintain their distance or limit their gatherings or get vaccinated because I tell them it's a good idea or the governor says they should do it or the president says they should do it. We should do those things because we care enough about the people around us that we want our community to be safe. We've lost 480 Yellowstone County residents in COVID-related deaths. One of the things that Riverstone Health made a commitment to from the very beginning is we would recognize every death. It probably seems to most people like putting out a press release is not that big a deal. But putting out 480 death notices is just a lot. It's just hard. And, you never want to sound like, this is just sort of a no big deal. But you have to be able to say in a lot of different ways that we should be concerned about this. We should care about this. It's worn people down.
Yeah, I can definitely understand how it's worn people down. And also nice that you made that choice to honor every single life, of course, and recognize the residents of our county who weren't able to survive this. Historically, looking back, what is maybe one or two things that you look back and say, wow, I can't believe that this is happening right now, and I'm in the middle of it, and here I am with my team?
I always think about, we had our first case on Friday, March 13th of 2020. You know how people say, I remember where I was when Kennedy was shot or when the Twin Towers were hit or when the Challenger blew up. I'll always remember where I was when I got that call. And I was in a parking lot. I was about to get out of my car. My phone rang. It was the state health department saying, we've got our first cases and some are in Yellowstone County. That was right before St. Patrick's Day of 2020. There was a lot of concern about people gathering, and we didn't know how widespread the disease was. And I issued my first order as a health officer with respect to the pandemic that first weekend. And it was a 7-day order to close bars and restaurants. It's really hard to tell people that you're going to close their business. But in retrospect, I was so naive to think that 7 days was going to make a difference. Because here we sit almost 2 years later, still dealing with the pandemic and illness and death and hospitalization. So that will always stick in my mind as, I think sometimes being naive is sort of good. And in that case, it probably was. I think the part that we probably didn't anticipate as much as we've seen is just how long this goes on and what the multiple waves mean. And, so we can work that. But I think that the hardest part and the most unexpected part from my perspective was the emotional and political response to a virus. I've often said the bug doesn't care, right? All the bug cares about is it wants to find a new host and replicate, and that's its job. But when it becomes a political issue and an emotional issue to the point that, I've obviously done a lot of press conferences and a lot of interviews. And fortunately, I stay off social media. I don't have any social media accounts, so I don't look at that. But we have people that keep track of that for us. And there's been about 6 times, I think 5 or 6, where we have actually reported threats to law enforcement. Because the idea that someone really believes that my house should be attacked or I should be killed because I have a job that they find unpopular, it floors me. It's something that I never would have imagined we'd see in the world we live in today.
Right. That is very, very significant. Just the attitudes of folks and the response to this. And like you said, social media can play a huge role in that. I think sometimes people, they just think they're on social media and maybe they're not. They would say some things that they wouldn't say directly to you if they were in person. So always being safe. That's good to know that you guys have the protocols in place to be able to do that for sure. I think one thing that sticks out in my mind as just kind of a point in history was also back towards the beginning of this. And you had a testing day up at the Metro where folks could just go, and just being there in the car, sitting, waiting in line, and seeing how well you guys had organized that and structured it, and just seeing what you guys really pulled together in such a short amount of time was pretty impressive. What was it like planning these events and just coming up with all of this from scratch, really? I know you said you had practice, but it's different than the real thing.
It is different, but one of the things we've done for a long time, and it actually goes all the way back to the post 9/11 anthrax scares, is what would we do if there was a bio attack and we needed to distribute a whole bunch of antibiotics all at once? And so we have those plans, we've done those drills, and we basically modified those to do testing or vaccination or whatever has come along. And so we've got staff that really quickly would say, okay, we need to do testing. How are we going to do that? So we have to have someone we have to traffic control, and we have to have someone that's going to do the administrative part, someone that's going to do the testing, and we have to, send those tests off, and how do we respond with results, things like that. And the ability of our staff to just get in a room in a very short period of time, map that out, was really phenomenal. I remember when we did the testing at Metro, as you said several times, and then when we opened at the Shrine, it was in the summer, and our senior leadership team meets on Tuesday mornings. That's our regular meeting. And so there's, 11 or 12 of us sitting there, and all of a sudden, phones start to beep. And it was, we are completely overwhelmed. We haven't even opened yet, and there's cars out in the street, and people are yelling and screaming, saying, do my test. And that entire room got up, ran out, got in their cars, and we all went and we became we helped with the testing that day. None of us had ever done that, or not enough to really be good at it. But we had staff who said, okay, here's what you do. Here's your just-in-time training. Go do this. But I think we saw that from all levels of our organization, from the most senior leaders down to the most frontline staff. The willingness to just step up and do what needs to be done is something that I'm really proud of.
That it really is something to be proud of. It's nice to hear that everyone from the top down is willing to pitch in and help. And it's just everything has been so new over the past few years. It's great to know that you guys have wonderful teamwork here at Riverstone Health, trying to help all the folks out there in the community, because this is new for everyone. It hasn't been easy for a lot of folks. So we're all going through it together, right?
We are. And I think that's one of the things that that we learned early on is every time you do something in the pandemic, you do it for the first time, right? So businesses were closed for the first time, and masks were used for the first time, and we went to school for the first time, and we did sports for the first time. And I would never say we got it all right every time. If that was true, you wouldn't have seen all the evolution, you've seen all the changes and how things are done. But I think what this pandemic has showed is, first of all, science works. You know, people complain a lot about, well, CDC keeps changing the rules, and the rules change because that's what science does. You know, if we really believe that, you know, once the scientist says something, that's it, we'd still believe the earth is flat, right? We'd still believe the sun goes around the earth. And so science has done its job, but we've also had to adapt. We've had to adapt to, you know, when we needed to do more testing, but there weren't tests. When we needed to do more vaccines, but there weren't vaccines. When our hospitals were completely overwhelmed. And staff were out, and people were tired. And, you know, when you think about, at the peak of our two surges, to adding 130 or 140 patients to the hospitals on top of their usual busy caseloads, everyone in this community has just stepped up and done what they need to do under really, and many times really difficult circumstances. Not just difficult because of the pandemic, but because of the politics, because of the divisiveness of where society is. Again, because of social media. You know, I think if we've proven anything, we've proven that the public health and healthcare parts of our community they persevere. They just keep going back at it.
And I think it would also be important to note, just for the public to realize what your governing board is, you know, who is it made up of? And the decisions that are being made during the pandemic, those are made by a team. A lot of times you have experts, you have epidemiologists, you have physicians. Tell us about the team that is involved in all of this.
Yeah, so at the governing level, the city of Billings appoints 2 board members, and the Yellowstone County Commissioners appoint 2 board members, and the city of Laurel appoints 1. And then the other members are appointed by the board itself. And they go for diversity of, sort of social diversity as well as experiential diversity and educational diversity. And quite honestly, it's a really hard board to be on. So the reason it's so hard, I think, is because there's so much diversity that they have to deal with. So we've had, in a single meeting, they might talk about, some weighty matter of healthcare policy and a variance for a septic system. I mean, it's just a lot of stuff. So I think, the boards, they've had to learn as well. From a staff perspective, it really is, we are a very widespread organization. So we, obviously we're talking a lot about public health today, but we have a community health center where we do primary care. We've got a dental practice. We've got a residency program that we operate in conjunction with our 2 hospitals. We've got home care and hospice. And all of those pieces and parts have to be put together in a way that it works. And that's been the great journey. I mean, I've been here, as I said, for 17 years, and I can honestly say I've never been bored, which I'm kind of prone to getting bored. But when we look at, our first year, 1990, our first full year budget was about $11.5 million. 22 years later, we're at $60 million. We've added, 3 buildings on our campus. We've added a hospice home. We've had rural satellites. We've got school-based health centers. It's just been a great journey of growth and development and expansion and really fun.
Right. You guys have done a lot over the years. It's been great to see this new campus being built, a very nice facility to serve the public. So We want to thank you so much for everything that you do here at Riverstone Health, John. Yeah, and is there anything else that you wanted to add?
I think that the one thing I'd like to add, just with respect to the pandemic, and this is something I've said many times that people have to understand, all the good choices left the building on March 13th of 2020. The pandemic is all about managing risk and deciding which among the bad choices is the least bad of the bad choices. And so I wish people could just have a little more tolerance for understanding that there's a lot of people who are making really hard decisions that we never really thought we'd find ourselves making. And I think as a society, we could just stand with a little bit of kind of taking a deep breath and giving people a little credit for trying to do their best. And, as a society, we'd be much happier, I think.
I think that's wonderful advice. I mean, just if humanity could stop and take a breath and always remember to be kind, and that this is new. Novel means new. And so you have a team of experts and professionals from all different areas that are all weighing in on this. And we know that you guys are doing great work. So thank you for that reminder. And thank you again for letting us stop by Riverstone Health today.
Thank you.
All right. Well, that is all for now. And we'll see you next time on Your County.